In this video, we will discuss the indications, contraindications, adverse effects of Erenumab. Erenumab is indicated in adult patients with episodic migraine as a prophylactic drug in those patients who have at least 4 migraine days per month. It is not migraine attacks, but it is migraine days. For example, if the patient has 2 migraine attacks a month, each lasting for 2 days, the expected efficacy of the drug is shown in this bar diagram. The 50% responder rate is shown in orange. That is the percentage of patients showing at least 50% reduction in the migraine attacks is shown in orange. It is 30% for placebo and 46%. Similarly, the reduction in number of headache days is about 2.4 in placebo and 3.5 in Erenumab. That means it offers a slight efficacy over and above placebo, but this is statistically significant. The main contraindication for this drug is hypersensitivity to the active substance. So if the patient develops a hypersensitive reaction on the first dose, we should absolutely avoid the drug in the second dose. Other than that, major cardiovascular diseases are excluded from the clinical trials, so we don't know the safety of this drug in cardiovascular diseases. In post-marketing studies, severe constipation has been reported, and with serious complications. Some patients required hospitalization, some patients required surgery, so this has to be kept in mind before giving the drug. Those with already severe constipation may be better avoided. Serious hypersensitivity reactions including rash, angioedema, anaphylaxis have been reported with Erenumab in the studies. These can occur within minutes or sometimes up to 1 week after the treatment. So patient has to be warned that delayed reaction can happen, and he should be advised to watch and consult if necessary. This drug has not been studied in elderly patients above 65 years. But looking at the pharmacokinetics, we don't expect any dose adjustment of this drug. For mild or moderate renal disease, mild or moderate liver disease, no dose adjustment is necessary. And in order to improve the traceability of the biological medicinal products, it is better to avoid during pregnancy because there is no data. Even in lactation, after 1 week of delivery, this can be administered to the mother, because after 1 week the amount of IVIG secreted in the breast milk is negligible. So hence it is safe. If it is really necessary, one can use this drug. The other side effects to watch out: muscle spasms are common in post-marketing studies. 5% can have injection site reaction like pain, erythema, pruritus, mostly mild and transient less than 1 hour. They can develop urticaria, angioedema and anaphylaxis as already mentioned. Alopecia of unknown incidence has been reported. There is no or negligible influence on the ability to drive and use of machines, so that is not a contraindication. It has no interaction with other drugs, and more importantly, if there is no response after 3 injections, we should not continue the drug anymore. It indicates a failure of the drug. Thank you.